This
Want to say,
conference will now be recorded.
sorry about that. I would like to say welcome to everybody. Thank you for those who came back, and we have some new people here. So I would like to say thank you for, joining us as we work together to come up with the best health equity plan for Tarrant County. Please feel free to forward the health committee calendar invite to anyone who you think may be interested in collaborating with us. We also welcome members of the community. So anybody and everybody is welcome to join in and put together a plan for Tarrant County. Also, next month, we will start having listening sessions, which is huge in the community, in Tarrant County, of course. And we will hear the needs and concerns of those people who live in the communities which we'll be going. And they will help us kind of navigate us and what we need to put in our plan. We don't have a date right now, but we are looking towards next month. Once we have a date finalized, I would definitely send that information out to everybody. And that way, if you guys decide that you want to also attend, you're more than welcome. The purpose for the new people, just in case those who don't know what we do, the purpose for the health committee is to develop and promote health equity in Tarrant County through policy recommendation and implementation of the equity plan. The health committee, we meet every third Wednesday of the month. Miss Kylie is backup for me. She assists me with the health committee, and she'll also be keeping an eye on the chat. So if you have any questions, please feel free to use the chat, and she'll, answer those questions as great as she can. So with that being said, let's kind of jump into um, what we did from the last meeting. Just a little bit of a recap. So in our last meeting, for those who were here, um, thank you, Mr. Pierre. I'm sorry about that. Also, if you guys want to be connected with the people that are in this committee right now, networking, please put your information in the chat so everybody can stay well connected as well. So Mr. Gant went ahead and put his information in the chat. Thank you for that. Okay, so the last meeting we went over COVID-19, the vaccine rates according to race, um, and the positive cases and how COVID pretty much impacted mental health. We also went over medical mistrust, which was the history. We kind of touched in on the Henrietta Lacks experiment. We talked a little bit about patient experience, sorry, and that was more or less, I guess you could say, our own personal stories, and then those who worked in healthcare in a prior role, personal experience as a patient, and we kind of had, found issues with that. Lack of transparency on both ends with the provider and with the patient. We discussed that as well. Also, we talked about access to care, which is affordability. We talked about the high cost of prescription, high cost of insurance being, the deductibles, the copay, just insurance through your job. We talked about some resources, and then, of course, we talked about employment as it relates to access to care. Simply meaning, if you're not employed, how do you get insurance or medical attention? And some people just rather not have, insurance at all sometimes because it can be cheaper to go through, get assistance and have those type of medical care. So we did talk about that, and we touched a little bit on all of those things. Upon discussing all of these things, we came up with um, a health equity indicator, which is simply everything we discussed. And on the indicator, I just basically took everything that we discussed, you guys, and put it in on a spreadsheet. And so here you see where it's the indicators, which is the medical mistrust, accessibility, affordability, and then stigma. And all of these right here are things that we are wanting to measure. So, under medical mistrust, we said that these were all the issues that we were having um, within that area. So, what I would like for everybody to do is take a look at the chart, the spreadsheet that I have made, especially the new people. And I want you guys to see if I missed anything, if there anything you can add to it, and see what other add to it, or see if I missed anything basically. Also, I'm sorry, I've got some private messages. You guys, if you can, I'm just going to say again, can you please turn your cameras on, because we will be discussing things, together, and we kind of would like to know who we're talking with. Um, so again, looking at the chart, I'm gonna just open up the floor. I tried to remember everything. I did my best. Uh, could you let me know if there's anything that needs to be added to this spreadsheet? Because these indicators are what we're going to be putting our plan together. And this is extremely important in putting a plan together, because these are the things that we're saying as far as it relates to health. These are the issues that we've deemed as most important. So just take a moment. Hello, welcome everybody that just came. Just take a moment and just look at those, and let's see if we need to add to that. And I'll make sure that, I do that moving forward.
Tanya, I'd like to add one. I think under potentially medical mistrust or stigma, it'd be interesting to add lack of provider diversity.
Okay. Under medical mistress.
Yeah, or potentially even under stigma, or if you're like using the measure for multiple points, I think it can fall under both. But I think it primarily falls under mistrust.
Okay. That's actually
Hi,
a really good one.
can you hear me?
Yes.
Hi,
Hi.
my name's Wendy Sosa. I'm with Cook Children's Health Plan, Medicaid and CHIP and Star Kids. And I recently met with Pastor Tatum in 76104 Morningside. And we are going to start partnering together because that community needs us more than ever. There is a mistrust. He described it as depressed, depleted, and dehydrated. Those are three very impactful words, right?
Right.
And there's a lot going on in the community as far as I think that if we talked on the ACE study that I mean they've been sexually abused, verbal abuse, physically abused, they've been neglected and generationally. And what he says is that there are no doctors, no clinics in Morningside. There's no pharmacy nearby. Um, so I am really glad to partner with this committee and get to know you to see how we can improve Morningside. But I would add to that that it would be building trust and someone to have accountability when they make a promise that they actually follow through.
Thank you for that. And welcome. We're happy to have you. And yes, building trust is a huge one. I will say that I believe that goes into lack of transparency too. Um, the last meeting was very heavy on trust building. So you're absolutely right. And we did talk a lot about the 76104 area. So yes, trust building is central. Um, as far as those resources, and there isn't any close pharmacies in that area off of Morningside. I'm familiar with that area. So yes, those are things that we need to know, we need to learn, we need to hear from the community, so that we can help and be able to provide some type of service or some type of any resources to help these people, especially if they don't have transportation to get to these different things. So thank you so much for that input. Anybody else?
So this is Shelly with the Alzheimer's Association. And this is my first meeting with y'all. So I apologize. I'm not totally up to speed, and I'm not 100% sure this even fits, but because I work with people who have Alzheimer's and dementia, one of the things that I know is that sometimes they don't know, they see changes in a loved one, but they think it's normal aging. So that's kind of a barrier for them getting help. So I don't, it doesn't cleanly fit with medical mistrust. So I don't know if that has a place on this document, but just a total lack of awareness that there is a problem.
Thank you so much for that and welcome. I will say this. um, Health is such a vast topic. So thank you so much for even being here with us because I'm not so familiar with that Alzheimer's and things of that nature. However, it's important to have diversity within this whole committee because it reaches and touches everybody. So, with
Mhm.
your expertise, we definitely can get something within our committee to help those who you know and service, in the area that you work. So, thank you so much for that. I will say that that does fall under trust, so we definitely will add that in. And education, as far as medic prescription, financial, it just goes across the board. So thank you so much for that, and I definitely will make note of that. Um, I'm just looking right now and seeing what else we can put it, but I believe mistrust is probably good. So thank you for that. Thank you so much.
So with
Any
that, I'm sorry.
Go ahead.
This is Pierre. Uh, Going back to the Alzheimer's, would that go under the stigma of Alzheimer's? Because we were in a think. Uh, Shelly, what did we call that last week in Forest Hill, where we had a community come out and we spoke about
Mhm.
different barriers. So
Right.
and one of the stigmas of Alzheimer's or any
Mhm.
condition is faith based. Like if you one could feel like my religious conviction is so strong that my trust in faith of what I believe in God or whatever supersedes the doctor. So that
Mm,
could be the stigma of that faith, and that's a deterrent from going to the doctor. We're going to pray about it first, and then we'll act upon it.
Yeah,
And that was
that's
brought
a
up in
good
one of them.
point. Yeah, the event that we had last week, we just called it a community forum or listening session.
I
But
was
there's
act.
also,
Oh,
Mhm.
go ahead. I'm sorry.
Well, I'll jump one more thing and then I'll stop talking. So there's also just stigma related to when a person does have dementia, when it's known, family members are embarrassed because it is sometimes, confused even with mental illness, which shouldn't be embarrassing to people, but it is. But there's a lot of reasons. Also, behaviors can change in a person with dementia, so there is a stigma attached to it, and people will often, do less. But what Pierre is saying makes absolute sense, that sometimes people, because of faith, will avoid diagnosis or interacting with the healthcare world for multiple reasons, but somehow related, kind of grounded in their faith and their belief system.
Thank you so much for that. And yes, I would have to agree with the stigma. So I would definitely be adding it under stigma as well. And just to go back to the chat, Miss Maggie, thank you so much. I am not ignoring you. I see everything. You're really giving us some great input in the chat, and I'm definitely going to be adding these things onto the our indicators chart. So thank you so much. And yes, Kylie is keeping up with the chat, like I said, but she's really, really doing a lot in the chat. So yes, thank you so much for that. Anybody else would like to add anything?
I'd like to add health literacy under accessibility.
Wow. Yes.
Yeah, I would have to agree to that too. Thank you. That's a very strong one. Yes, health literacy. Thank you so much. Okay. All right. Anything else before we move on? Are we set on these? Or do y'all feel like something should be moved? Is this a good chart, measuring chart? Are we good?
Tanya, I had added in the chat, maybe it could be worth adding like a healthy aging indicator as well.
That would be good because I didn't think about that until now, till today. So yes, we can definitely change this up. This is not set in stone as of yet. So yes, thank you for that, Kylie. All right. So with that being said, I think we'll go ahead and we'll move on. So we are coming up with a policy. And part of us coming up with the policy, you guys, is that we're looking at good versus bad policy. Um, so this is one of the policies that I have pulled, and I just want you guys to kind of take a minute and look at it. It's race-based medicine, and it's just one that's just stood out. So right now, y'all can just take a time and kind of read over it. And I want to know if you guys would consider this policy to be good or equitable or bad. And then how, if it is bad, let me know. And then just looking at it, if it is equitable to you guys, how can we make it more equitable? Um, and when we think about policies and what make a good policy, it's important to consider its impact, and the impact is it equitable, and does it place a burden on a specific population? So if you guys will go ahead, this is also from race-based medicine policy from the American Academy of Family Physicians. So just right now, if it's too small, you can always put your mouse over it and it'll make it bigger for you guys to kind of read over it. I don't want everybody squinting and hurting their eyes. And if anybody, feel free to go ahead and chime in. And once you're done, if you like it, you don't like it, what would you change? What would you add? Because, like I said, we're reviewing policies. We're trying to come up with one on our own. And I just need to know, feedback so it can kind of guide us in the way to figure out what kind of policy we want to come up with as a group
I
collectively.
I have something to say, but I always have something to say. So you can tell me to be quiet. Wendy, be quiet, because I will always have something to chime in
No,
about.
no, I love
Talk,
it when everybody
talk,
talks. So yes,
Wendy.
Ah,
yes.
yeah. Okay. So race is a social construct that is used to group people based on physical characteristics, behavioral patterns, and geographic location. Now, a lot of health related illnesses are due to culture, right? Based on what we eat. So
Hmm.
certain foods would create diabetes and heart disease, high blood pressure, as opposed to other races or cultures. I also think that sexual habits are also, you know, certain ethnicities just kind of. So we need to educate on healthier sexual habits, um, based on race and culture and ethnicity as well, and sexually transmitted diseases. So I don't know if that fits into any of this. I have missed your previous meetings, but I really have 76104 on my mind, and I'm like, Pastor Tatum and I, we have this energy going. We're like, we're gonna change the community. We're gonna educate everyone on syphilis and HIV and the shame, and so they don't go to the doctor, and then they are promiscuous and pass it along, and then food. It's the food and the culture of different choices that they eat are and finances, right?
Hmm.
You eat what you can afford, and the better foods are always more expensive, it seems. So educating on how we can eat a little bit healthier, maybe on a budget. I don't know, but anyway, I'm taking that all kinds of different directions. But that's my 2 cents.
Okay. Thank you for that. No, I really appreciate the mindset of getting the boots on the ground and just like really getting at it. I love your energy. I love how you're ready to make a change, and we need that type of energy. And people in the community need to see us with that type of energy because it shows that we care. We want to see change just as much as they do. So I definitely agree. The last meeting, we kind of just, met each other and kind of talked about the different little things of like, what we decided would be the most important to tackle first as it relates to health. And so that's just what this is. And so right now, what we're doing is coming up, we're looking at policies, we're reviewing policies. And right now, I'm just asking you guys, with this policy, if we was to do something similar to this, would you guys like it? And if something in this policy right now that you see, it doesn't stand out, I mean, something that you don't like that doesn't stand out, um, or something that you don't like stands out, I would like for you like to let me know because we're going to be doing a policy, and I want everybody to be on the same page with doing it. Um,
Yeah, I guess my fear, I'm sorry if there was someone next, forgive me for stepping over. I guess my fear with removing race as a barrier because it is a constant in how the medicines are made and predisposition in race. Like, I don't know enough to quote it, but there is a predisposition of African Americans or African slaves that came over to high blood pressure, how they survived that voyage, and now you predisposed with that gene. But in agreement with Wendy, it's like, hey, if you change diet and all, but then there's an unconscious biasness toward
mhm,
how some doctors speak to some folks. And the pain threshold, they've done studies how some doctors, you okay if you're black, you can deal with that pain, and how they prescribe medicine. It's like
mhm,
like just using lisinopril. Some people could take that blood pressure medicine, but it's often prescribed to blacks, and there's an adverse reaction to that. So sometimes the genetic markers, and I'm not a clinician, so if I'm wrong, forgive me. I'm not trying to be one, but I think you have to look at how which medicines are working for which group of people, but
right.
exercising this. But if you live in a food desert, I'm passionate like Wendy, and she's a great friend as well as Pastor Tatum in that zip code. But if you don't have it accessible, you can't really move it into say, hey, just eat some apples and that blood pressure is going to go down. We have to study to see what works for which. I just got my labs back from my doctor, and one of which would, I don't have it in front of me, but it was a marker on it that I was normal, but it normally runs high for African Americans, and that's what I identified myself as. So they're telling me that race does matter.
Mm.
So I think I'm Stephanie. Hi guys, I apologize.
Hi.
So I actually maybe I'm not a fan as much. There are parts of this that I do think that are very valuable when looking at the policy. I am actually currently like doing work on like DIXS and research on like I'm passionate about decolonization of healthcare because I think oftentimes how we view our health system and the structures and even the construct of race is with a colonized perspective about what is right, what is healthy, what is well, that kind of thing. And just in a greater scope of this, I think it's one thing to say that we're going to remove the race as a social construct from the discussion and review of how we look at symptomology and presentation of a patient, but what are we adding to this? And so that's my problem with the policy. It says what we're taking away, but it doesn't talk about what we're going to do better, what we're going to do in addition to. And I think that's what's really important is that because there are differences. We have to be aware that there are, just because of the cultural landscape and how social determinants of health exposure and influence and how we hold trauma, to Pierre's point, and how our body responds to different things. There are things that have to be considered, but that doesn't mean that just because if we remove race as a construct from the policy, we have to talk about what we're going to do in addition and for awareness.
I love that.
I
Yes, I
Yes, I
agree.
was just gonna say I really, really can appreciate that. Thank you so much for that.
And I know
Anybody
Stephanie
else?
is the all-star team.
Anybody else? Okay. So thank you guys for that input. I would take those into consideration. Very great input. And Miss Stephanie kind of just ran it home. Thank you. So let's go on to the next. So these are some examples of some framework that we are looking at. And one of them, the one with the green border, that is from Minnesota State Equity. And if you see the outline and just the different things that they're looking at here, like the policy purpose, impact, and so on and so forth, and then the guiding considerations, if you guys want to take a look over that. I was looking at these two frameworks. One is because it's very simple, it's to the point, and it's easy for people in the community to also read if they wanted to, get their hands on, our work and what we're doing. Is simple enough for somebody pretty much with like a third grade education can read it. And that's also important, for the people in the community. We don't want to give them something with such fancy, wording that they don't understand what it is that we're even doing for them. We want to make sure that this information is accessible to them as well. So I really appreciate this format of the framework of these two. The other one is the CDC's uh, policy analytical framework. So I was just wanting to know if you guys looking at these two, how do y'all feel about how it's set up? How do y'all feel about the questions on it? Um, how are y'all liking this type of framework? Because, like I said, when we get ready to start putting things on down on paper on documents, I really want to know what direction everybody wants to go.
I think I hate to. I'm new here, and then I keep talking. I
I
think
know you're
a
good.
hybrid. I think a hybrid of both would be important because they address two different perspectives from the framework. So one of them is about the health equity lens, and then the other is about like feasibility, the weight that it would take to get it pulled up, and the impact. And so if there's kind of a way to include like the equity perspective from the green one, but then also
Mhm.
include like criteria perspectives as far as impact and feasibility, uh, like those type of questions that are there, about like what it would take to lift those changes, I think is important.
Yes, ma'am. I like that as well. And because they're so different, but yes, I like information in both. And that's why I chose them. So, yes, you kind of seeing it through the same way that I am. So, anybody else feel the same way or feel more about the other? So, Miss Stephanie kind of spoke for everybody. Everybody can agree with Miss Stephanie. Okay. All righty.
Yes, I agree.
Okay. Thank you. All right. So these are some of the recommendations. These, which is Arlington, Fort Worth, King County, and in the Boston Public Health, they have all already put together a pretty much an equity plan. And so what we're doing is we have been kind of looking at how they have constructed their plans. Ours is also um, more for COVID related things as well. So theirs was like before COVID. Some of it is during, but ours is pretty much how everything was affected during COVID, right when COVID started. And we're trying to, figure out how we can help a lot of these different disparities. So Kylie will drop in a chat the link to each one of these. And, whenever you guys have time, y'all can just check these different these 4 different plans out, because like I said, we're kind of looking around and seeing what everybody else have already done, and what worked, what didn't work, to put together our own for Tarrant County, and then we'll move forward from there. So yes, if y'all are interested, Kylie will put all that in there. Y'all can just save it, or click on it, read it at your leisure. They have some really good stuff. Now, I will say King County had some very great strategies. I really enjoyed their setup on how their wording was. They had very great graphs in there. It was very easy to read. You could really understand and see the different steps that they were taking. Um, they all were good, but I will say King County was my personal favorite. So whenever you guys have time, just check those out. Um, and then, the next meeting we can come to and we can say, okay, so which one do we all like? And we ready to go ahead and put something down on paper and, get the ball really moving. Because especially with next month, us going out and having these listening sessions, we're going to the communities. We're, wanting to know what's going on, how they feel, what's the biggest impacts that they're having in their lives. And we're gonna the ball is about to start rolling quickly, so we definitely need to have the format in which we want to put everything in. So with that being said, um, also we will discuss long-term, short-term, medium, and long-term goals also for our plan the next meeting. So, and with that being said, you guys, I am going to open the floor up, and based off what we have learned thus far, ideas, input, what do y'all feel about the different plans? What do y'all feel? I mean, anything that y'all have that y'all need for me to know. So next meeting, I will have something prepared for us, something for us to go by, our research, do whatever it is that we need to do so we can go ahead and start putting a plan in place. So I'm gonna open
I
the
have a
floor up.
question for I have a question for you. You said Tarrant County, and Tarrant County is huge.
Hmm.
Are there specific zips targeted to the ones that need it the most?
Um, we do have some that under underserved communities. Obviously, we are doing it, but we are wanting to service Tarrant County. But we are looking at the underserved communities first as priority.
And you've identified those zip codes?
We have, I believe, Kylie, don't we have a spreadsheet with the different zips? Yes, I can share that with you guys next time if you want it, or I can email you directly if you want that information, to let you see which zip codes we have identified as most um, needing the plan most. Yes, ma'am.
Okay, great. Thank you.
Hmm.
Two
I'd like
quick
to
ones.
add,
Go ahead. You can go ahead
oh,
and
sorry, Pierre.
I'll hold my question.
Okay, thank you. I wanted to add to Wendy's question about how we decide where exactly we're doing this. So the really cool part of this whole project is that Tarrant County, like the institution, is putting together this plan to be disseminated, but it's equally as much us partnering with you guys in your organizations and trying to make sure that we're available to help review your policies to make sure that they're equitable, and to help you develop your own equity plans for your organization, that you can really streamline your own processes, and try and make sure that at least the communities that you guys are touching are receiving that same level of equity as we're trying to put out, but from a very large scale.
Thank you for that, Kylie. Yes, we're definitely partnering with different members of the community. So yes, thank you for that. I totally forgot to mention that. So yes, if you guys, want to, I guess we can actually come in. Let's say we also review policies. So if it's a policy within your organization that you guys may seem, maybe this can use a little bit of a tweaking. We come out, we'll review policies, and we just make suggestions and just kind of partner with you guys, and so on and so forth. So thank you for that, Kylie. Mr. Gant, you had something?
Yeah, I couldn't open the King
link. And also, and forgive me for this, I was just trying to put in the notes that if I had to explain this meeting, the Tarrant County policy strategic goal of what equity? I'm missing something to it. Um, we're trying to create equitable policy for health as it relates to Tarrant, or reviewing the current policies.
So this is going to be a new policy, and we are my sector. We have four right now, and those four is the health, transportation, communication, and did I say communication? Communication. So those are the four. And I'm just working primarily with health. And this whole thing came about when COVID happened because there were so many different disparities within Tarrant County, especially in the underserved neighborhoods. So what we're doing is coming up with a plan that only services Tarrant County, and we're trying to make things more equitable as it relates to all four of those areas.
What was it? It
Thank
was
you.
health, transportation, communication, and
Was
Um,
it housing? We missed one?
yes, housing. Sorry.
okay. And then how does this trickle down to actually get to the community that needs it? Once you've identified it and created a policy, then what? How are you what are you creating more buses and lines of transportation or health? Are you going to local churches to do COVID vaccinations or immunizations? Like what how does this trickle down into the actual community that has the need?
So, with transportation and all of those other sectors, they have their meetings, so they will be able to kind of tell you guys more about those. So, I will definitely give the information to those other sectors. However, that's where the listening sessions coming in at. And yes, we are going to the community. We have actually partnered up with a few different organizations and just kind of getting feedback from them. We've had meetings with Catholic Charities. We've been out. Transportation actually went out and met with the people who do the public transit. I can't remember which one that they went with, but so yes, we're in the community, and these listening sessions is going to help us listen to the people in the community and figure out what we actually need and where to start. But we definitely want to get into the community. Churches is definitely another one, and we are starting to make connects now and networking so that we can go ahead and you know see the people and meet the people where they are. So yes, ma'am.
Will we be getting like elected officials involved, CEOs, decision makers? Because I understand we as a grassroots can do and think and come up with brilliant ideas. And I'm not trying to be a naysayer. I'm supportive, but
Mhm.
the policymakers who will be targeting, let's just say the red hat or the society or whomever, or any lobbyist that could actually create the change within with this.
So once we get the policy in place, I'm sure it has to get approved.
Mhm.
But right now we are working on it, and when it comes to getting approved and how all of that works, we will cross that bridge when we get there, but we definitely want to show like, hey, this is what we're doing, this is the progress that we made, this is our policy, this is our plan, these are our steps, this is what has been done, this is what things look like before, this is where we're at now. And once we get those things in place, then we can go and say, they can say whether or not they want to approve certain things. But that doesn't eliminate the work that we're putting in place for all of these different sectors.
I love it. Thank you.
hmm Anybody else?
Yeah, I'll add something real quick. I think a lot of our early work is going to be, and early being like the next year, pretty much. Although this grant does end in May of 2023, we're hoping that it does get extended so we can really continue this work because it is way too large to get done in one calendar year. So a lot of our early work will be writing these recommendations and setting short, medium, and long-term goals, and we'll be focusing on those short-term goals that are going to be like collecting more data points, surveying most of these parties involved, whether those are providers or community members or executives within partner organizations, and then really trying to start educating people, because we can see a really immediate change with education and data collection, and then most of those medium and long-term goals will follow suit based on those, based on like data collection and community education.
How do you get your data collection? Do you send out surveys to each household? Do you participate in events and ask questions to those participating in the community events? Like how are you guys getting this data?
So that's kind of what we were meeting about today, is trying to figure out what exactly we're trying to measure from those equity indicators, right? So if we know that we're wanting to look at medical mistrust, and part of that is, cultural competency training with physicians, then we'll go meet with these organizations so that we can actually start getting something put into place. So today's meeting was to develop which data points are going to be important to us and how they fit in. And next meeting, like Tanya was saying, is where we're actually going to start writing those goals, which is where we can basically like timeline those things out for the true data collection. So I'm sorry if it seems like kind of disjointed. We're learning as we go. This is the first time that we've ever had a project like this. But we're trying to do as much as we can within 1 year.
And then I will add that we went to the African American Expo that was located at Morningside Middle School, which is in the 76104 area. And we had a table there, and we did have a survey. And on our survey, it was kind of just asking what they would like to see community wise. So we are doing survey and we are taking data and getting information in these areas. Also, we have, I forgot to mention, outside of the main four, we have education. And so we have partnered up with a few, Fort Worth ISD. Tanisha also has somebody from Everman. She's looking into those different school districts to help and get those kids and parents or whatever it is that they're needing. I'm not over education, but she's networking with them. We just added policing, so we're looking into that as well. And then, Kylie, am I missing one? Economic development, I believe it is. So we're getting out there and we're starting the groundwork now. But like she had mentioned earlier, we have to first, as a group, say, do y'all believe this is what we need to go and measure? And if not, what do y'all know? Because we're not everywhere. And y'all might know something that we don't know. But however, we are in the communities. People are getting familiar with us and we are putting in the work. So that's, we're starting, but we're doing.
Yeah, and just to kind of piggyback off what Tanya is saying, something I try to emphasize I'm over the communication and education sector of our equity plan. And something I always try to emphasize to my group members is this is your plan. Like, so the questions that you're asking, these are the questions that we do need to know. That is how we do get our data. I mean, not necessarily our data points, but the places where we do need to begin doing the research is when we do get this kind of feedback from you all. So there are a lot of things that we don't know because we're right here in this office. However, that's why we are doing these meetings and reach out to so many organizations. And at the beginning of the meetings, always saying, if you know somebody or if you feel like somebody can benefit from this work or you feel like somebody can contribute to the work that we're doing, please invite them, because we don't know everything and we don't know all of the points that we need to be researching. But when we hear it from you all in the community, then we definitely can, begin to do that research and begin to implement the necessary things. So, I mean, it is very much a community thing that we're doing here. It is a baby, it's brand new. So, we're definitely figuring things out as we go. But, it's really more than anything about the input that you all put in, because we want to know what you all need. These are your organizations, these are policy frameworks that we're hoping that you all can implement into your organization. So we need to know what's going on with your organizations and your communities. That way we can make sure that the plan that we are creating together, all of us, not just the health equity team, but you all as partners here with us, that it's applicable to all of the communities that you all are serving.
I can speak for my colleagues, Wendy, Shelly, and Deanna. We are all in the community. Like if it's with the African American Expo, or like I'm on the board with the Hispanic Wellness, that maybe if we get more people, I'll get those folks in, or even the IDD component. That segment is missing as well. You know, people with the mental health, even those groups. I'll try to invite more to it. If you all need anything, I could think of who's missing from this arena. You know, my email's in there, but collectively between the groups that we work with over the years, I can find that person for you.
And you know what? Thank you for that. And like I was mentioning earlier, like Miss Shelley, who has the background in with Alzheimer's, like we didn't even talk about Alzheimer's in the last meeting. So it wasn't even a thought until today because she's here. You see? So we need people from different organizations so we can put together something that everybody can kind of relate to. It's definitely a baby, but I believe also, like I mentioned, I'm sorry, people from the community can be in here. Their input is also important. It doesn't have to be somebody from an organization. It can be 5 people from 76104 and so on and so forth. What do y'all want to see? What is it that y'all feel like y'all are lacking? What changes do y'all want to see right now? What's the main thing that y'all feel should be the first thing that we should tackle? Like what is it? What's going on in your community? And so that's why we have added the other sectors, which is education, economic development, policing, these different things because it's so much to cover. It's very big, but I feel like this what makes this work so great is because it's also saying to those people in the community, y'all matter and y'all can be a part of making where you live great. You know, you can change your circumstances and your situations by coming in and participating. So and then having different organizations back that and networking and we come together and help one another basically. So that's basically what this is. And so we're it's new, but we're definitely putting in the work like I mentioned earlier. And I can definitely appreciate you guys and your colleagues for what y'all do out here in the community. And I just want to say, Miss Wendy, thank you for your questions. I mean, they're very insightful to get the feedback from everybody else. Everything is very insightful. So thank you so much for that. And with that being said,
I
anybody else?
think I just have one more thing to say. So I work in oncology, and so I think one of the things that I think I was coming in as y'all were moving away from the list of priorities, and so I'm not sure if it's on there, but I think when we think about screening, I think there's one thing about routine care and access to primary care, but I think there also has to be education about screenings and about uh, access and about because people will go in for their regular checkups, but they don't know their timing of their screenings and preventative medicine. Because culturally, people with deficits, especially economic deficits, and we're just going to the hospital for when something's happening, and a lot of education isn't given on what preventative medicine actually looks like, because people are just trying to engage us to even get us to the PCP in the first place.
Right.
And
And
to
I would
have those physicians talk to them on their level, right? And not use
Exactly,
those big words
exactly,
because then they walk away feeling like, oh my gosh, that's why I never come to the doctor. I don't know what they said, right?
exactly.
Yeah.
And it was already a build up for them to even go in the first place. And then they walk out of there and they're like, oh my goodness, right? So
Right.
right.
100%
And
agree with
that's
you.
what right. And I do agree as well. And we kind of touched on that in the first meeting. That was a big part of it. And that was saying, people don't go to the doctor until it's too late. And they don't get the education that they need as far as preventative measures and things of that nature. So yes, you're absolutely right. I will add that on our indicators list. But
Okay.
we definitely touched on that. And it's something that needs to be touched on quite a lot more than what it is because a lot of people just don't know, and then some
Right.
people because they're not educated on it they don't care, they don't, it's not even a thought.
Well, I
And
think it goes. I'm sorry.
go
Oh,
ahead.
go ahead. I didn't mean to cut you off. No, I was
I
also
was
going to say it also goes to research. I'm sorry. I think I have a
no, go
delay too,
ahead.
so that's my computer. So I also think it goes to research too. Part of what happens is that To Pierre's point, I think he made earlier about medications and how they interact with our systems. Oftentimes, we don't know until multiple people of color have had contraindications to medications in real life because we're not part of studies in regards to medication and utilization and even disease trajectory. So maybe there's also some areas where health equity is an issue in regards to research, medical research, because we don't want to participate in that because of the historical context, but also that means that we don't get to be part of making sure that medications that are used actually work for us.
I agree.
Mhm.
That's yes. Yes, that's
Alzheimer's
all
brain
I have.
study.
So with that, I mean, we have a lot. And Miss Stephanie, you're very insightful. It's things like that, you guys, like we all need to come together and we learn from one another and we like I said, that helps us come up with a great plan. So I just want to say first and foremost, thank you to everybody who have given input and thanks to everybody who's been here. Um, I kind of looking at the time. I don't want to go over on time for anybody. So with that being said, does anybody have anything to say? And I am making notation of all of what you guys are telling me.
Can you provide an email to all of us with each other's email and kind of what we do? I think it would be great for us to partner on so many different levels with so many things because our community needs it now more than ever, and it's only going to increase, I think.
I will. I don't know exactly what everybody does, but I definitely will provide an email list for everybody to kind of go and see. I might reach out to everybody individually, the ones that I don't know, and get their information that way. Yes, networking is essential. So yes, I will do that for you.
Thank you.
Yeah, at least y'all committees as well. And if you have a little
Hmm.
time, if you could send me an email, I want to try to pick your brain on something or even introduce you to more people that can help your committees.
Yes, yes, I sure will. And yes, my team members, I think they already put their information in the chat. I'm not for sure. Um, you guys, if y'all want to go ahead and drop y'all emails in there, if you haven't already, so they can get have access to you guys as well. And Mr. Gant, yes, you and I definitely can talk because we definitely can utilize more members. I think, but in this case, the more the better, because
Yeah,
it just widens the scope.
mhm. Muslim community, Asian community, people like I'm a part of the mayor's committee on people with disabilities. Those are the other players to get involved, you
Okay,
know.
okay, that'll work. All right, you guys, and let me just go ahead and do this
A
too.
quick question. Is there any collateral available to, like, if we wanted to invite people that we could share to show what this is and why they need to participate outside of saying, hey, come, we're talking about health equity? Because I don't even know how I got invited, really, but I'm glad I'm here.
It's
Um,
probably Merville.
I,
Yeah,
right.
but verbal,
Word to mouth is something. We don't have any collateral as of
Yvette,
yet, but I will bring
put
it
your
up to
mission in.
my for my supervisor and
Yeah.
ask her, hey, this is what the folks are saying, and see what she says, and maybe we can do something like that for sure.
Or just a short bit, couple of sentence verbiage, because I was like, yeah, I want to get my managers. I'll have a ton of input. I'll have a ton of resources, but the buy-in. This is something they can build upon, and maybe we can get some higher ups to get involved
Yeah.
in this.
Yeah.
That's what angle I was going. So, Kylie, forgive me, my brain got fried from about 10 meetings today, and I was like, "Is this a committee? Is it what are we called?" I was trying to write my notes. I'm sorry,
Definitely. I'll try that angle.
y'all.
I think we feel you, Pierre. I mean, it's like, oh, you have 12 to 1. Let's go ahead and put a Zoom call right there. You don't get lunch today. Right.
Hmm.
Yeah.
All right, you guys. Well, if that is the case, I got a lot of work to do, and thank you guys. And if there isn't anything else, I give y'all 1 minute of your time, just one.
This has been
But
fantastic. Thank you so much.
Yes.
no problem. Thank you guys. We need you. So thank
Thank you.
you.
It's a
All
team
right.
effort. Bye.
Bye
Bye.
bye.
See you at 4, Shelly.
Pierre, I'm gonna call you.
Come on. All right.